Got a couple guys in here who are going down to the game. We haven't caught up with our buddies from Babsocks in a while. Jake and Tom are in here from Babsocks. And the IQ level in the room escalating quickly. We have a doctor in the house.
Yes.
Make sure I get this right. Dr. Katy Kamkar from the Center for Addiction and Mental Health, CAMH. What's happening, guys?
Oh, not too much. We're just, glad to be back. Having a great day for Bell Let's Talk here, and, just appreciate the chance to talk about what we do.
Absolutely. So take us through this, because Bell Let's Talk Day, obviously we've been doing this for a few years, but you guys are really connected to it this year. The CAMH Purple Babsocks, I'm wearing my pair right now. I know a lot of people are around TSN. Available at babsocks.ca, and 100% of the proceeds going to support CAMH to help end the stigma surrounding mental illness. Tell us how you got involved in that.
So, we've been working with CAMH for, I think it's almost 3 years now. It was a bit of a whim decision when we were just starting the business, and we knew we wanted to give back to the mental health landscape, but to sort of give back 100% on Bell Let's Talk. And it's just sort of built from there into sort of a really fun movement for people who like our brand, like the socks, and a good way for us to raise not only money, but a lot of awareness for CAMH, because they do such a great job in our city.
And Babcock's a big part of that too, right? Like, he's been a big supporter of what you guys are supporting as well.
Yeah, every time we reach out to Babs, it seems like he's on board, so long as we're representing him well and, the mental health community. I think it's something that he really believes in. So
I think today's a fantastic day, what everybody's doing, promoting it, helping people get help. But wouldn't you say that the goal is for it to be every day where you can offer help? And although I'm not putting anything against today, but tomorrow, when everything kind of goes silent, it should be a day where we still are not afraid of help and offering help and all the other good stuff we're doing today.
Absolutely, and I think we could not agree more. First of all, really, with the Purple Babsocks, we are so grateful. What a life-saving work, and all proceeds going to CAMH's foundation, and it's a life-saving work. And I agree with you. Today is a wonderful day, Bell Let's Talk Day, and of course, we want to have this conversation going every single day. And the reason being is that no one is immune to mental illness. Every single person is affected, either directly or indirectly. So no one is immune. We have noticed an improvement in the past 5 to 10 years in terms of reduction of stigma and opening up the dialogue. Obviously, there is further room for further improvement.
That's where I was going to go. Where in the last 5 or 10 years, you mentioned education has been there, there's been support. Where do you envision 5 or 10 years from now this going?
Well, we definitely need to further our effort in terms of stigma reduction, to further our investment towards mental health research and treatment, definitely innovating research, because the more we can have this research and science, the more we have a better understanding towards the origins and the causes of mental illness, and subsequently towards treatment and treatment outcome and better prognosis and return to healthier level of functioning.
Our buddies from Babsocks, Jake and Tom, are in here, and you're hearing Dr. Katy Kamkar from the Center of Addiction and Mental Health. Again, today is Bell Let's Talk Day, and between now and midnight, Bell will donate 5 cents to mental health initiatives for a number of different ways that you can get involved, including every text sent, every social media view of the official Bell Let's Talk Day video. And again, Babsocks, with their purple Babsocks today, 100% of the proceeds going to CAMH. When you start talking to people who are around people that deal with mental health issues, not those that are suffering from it, but their families, their friends, their colleagues, what kind of message do you hope they're receiving on a day like today?
Well, their influence is it's very powerful, because even if they are not suffering, they know someone who is suffering, because as I mentioned, every person is affected. We have worked towards, in terms of stigma reduction, as you all mentioned, towards education and awareness, but then also towards reducing, obviously, dismissive attitudes, because sometimes we might provide support and unintentionally say things that might lead to self-stigma. So a lot of education towards stigma, self-stigma, and towards listening, acceptance, towards ways to show empathy and provide further support. The key here is not to suffer in silence and to seek care, to seek treatment.
So you're talking about education. I've got young kids, so I've got a 5-year-old and a newborn, a 6-month. Have you seen it start from a young age? Are you starting to identify, mental illness in children? Is there indicators that you're trying to teach people? For example, a parent like me, you say it affects everyone. Is there certain things we should be looking for, or is it just something that gradually you sit down through education, you learn about it?
Such an important, such important questions, because 70% of mental illness do onset in childhood and adolescence. So when we talk about mental health promotion, prevention, early intervention, all very important. And right now there are some places that education now, they're starting within kindergarten. So now we all know about programs around teaching children about finances, but now also about programs about teaching children about health,
right,
about mental health, and also the teachers as well. And very important also for the parents, education to the parents, so that if they can recognize any signs or symptoms, especially behavioral changes,
right,
that could be key indicators that the child might need help, again, for mental health promotion, prevention, early intervention.
Okay.
We got a veteran on our hands. The lights just went out,
You just
and
kept
Dr.
talking. That
Kamkar
was
didn't
unreal.
even miss a beat. That was
Lights went
outstanding.
off, just kept talking.
Very well said.
CAMH Purple Babsocks are available at babsocks.ca, swapping maple leaf blue and white for CAMH's signature purple. 100% of proceeds go to support CAMH and help end the stigma surrounding mental illness. Jake and Tom from Babsocks, we always love catching up with you guys. Thanks for being here. Enjoy the game tonight. You guys are going down, right?
Go Leafs, go.
Go Leafs, go.
4 in a row.
Attaboy. And Dr. Katy Kamkar from CAMH. We really appreciate all the insight and for you joining us in studio.